Okay. We now turn to the story here with the Donald Trump administration on Thursday unveiling a plan allowing states to convert federal Medicaid funding into block grants, a longstanding conservative goal that critics warned could have a deadly consequence for millions of vulnerable people who rely on the healthcare system as a source of income. Seema Verma, the head of Medicare and Medicaid Centers for Medicare and Medicaid Services, announced the so-called Healthy Adult Opportunity Initiative in a statement claiming the policy will improve health outcomes and care for low-income people's claim there. Progressive advocacy groups warn the plan could do precisely the opposite by giving states a green light to cut Medicaid spending and divert federal funding to other state programs, potentially leaving millions without essential coverage. Poor people, disabled people in particular, are going to die, tweeted Alice Wong, the director of the Disability Visibility Project. Not an exaggeration. Urging the public to look beyond the plan's benign label. Public citizen healthcare policy advocate Egan Kemp said that President Donald Trump's nefarious program is just a Medicaid block grant by another name, and the opportunity it will provide is to miss out on needed care or go broke trying to get it. The only opportunity it will provide is, again, to miss out on needed care or go broke trying to get it. That's what's going on here. Kemp said in a statement, Trump's plan will ensure that many working families who are currently covered by Medicaid will face cuts to their services waiting for needed care and the risk of medical debt and bankruptcy from trying to pay for illness, Kemp said in a statement. These further attempts to cut health care are more evidence Americans need Medicare for all now to protect their access to care once and for all. I think that's pretty clear there, just to say the least. And it was incredible to see that, like, Trump is able to come on, he's able to tweet this out, and people are able to easily cover for him with the idea that I'm not going to cut Medicare. I'm not, like, your entitlement programs are going to be safe under me. The block grants, those are just things that really allow you as a state, especially a red state, if you live in a red state, to go against the idea of having steady funding pouring into this program, and that really takes away from its quality, and that takes away from its reliability and how it can help people in times of key need. So the proposal is, again, thank God, likely to face legal challenges, and invites states to apply for a waiver to receive a lump sum payment for the federal government for Medicaid instead of open-ended matching funds. Right-wing supporters of block granting Medicaid claim it would give states more flexibility, but critics warn the move could limit states' ability to increase healthcare spending in response to public need. Like, if you need it, you're going to have to apply for a waiver here to receive a lump sum payment from the federal government for Medicaid instead of open-ended matching funds, just having consistent funding time and time again. Any state taking this offer is engaging in fiscal malpractice, says Elliot Fishman, Senior Director of Health Policy with the advocacy group Families USA, in a statement. Furthermore, the administration is acting lawlessly. None of the statute regarding Medicaid match rates can be waived administratively. We are better than this when we, the American people, must hold the Trump administration and Republican members of Congress accountable. Congressional Democrats joined the healthcare advocacy groups in condemning the plan. Trump wants to destroy Medicaid while claiming to save it, tweeted Rep. Bill Pascrell Jr. The fiendish scheme is an Orwellian fable conjured up by the most shameless pack of liars to ever occupy our government. Never forget the Republicans' goal to steal healthcare from as many Americans as they can. And I think if you run that, like, you don't even have to run. You really don't even have to run if you don't want to. For example, on Medicare for all. If you're running in a red state, you don't really feel entirely comfortable on Medicare for all, you go ahead. You make your race about healthcare, and you make your race about Donald Trump trying to cut and steal healthcare from you. I think that if you make this race about healthcare, no matter what, hit it hard. Cutting entitlement programs, cutting these things like Medicare and Medicaid, like, this is what people depend on to live. It is so important. And if you continue to be able to cut that, it should at least have some sort of political consequence at some point or another. And I think if you really make Donald Trump feel the pain on this, it's going to be something that will come back to bite him in a pretty deep and pretty severe way. Thank goodness, because that is something that I think really should happen. And again, if you're out there, you're in a red state, you don't want to run on Medicare for all, like, that is perfectly fine, but you should definitely run on Medicare and Medicaid. He tried to cut them. He is coming for your health care. He tried to pass the Obamacare, repeal the Better Health Care for America Act, whatever that was called. That took away health care from millions and millions of people. He has already succeeded in taking health care from millions and millions of people and wants to do it to more people through the block grant program on Medicare and Medicaid. This is a broadly condemned thing. Just hit that over and over again. Make sure that people know, because it is really that bad when it comes to the potency that this will have. And people, they are going to die. So that is something that you should be highlighting there very, very, very intensely. So this is pretty interesting. An emergency physician Thursday night confronted Mike Pence at a restaurant in Iowa over the Trump administration's newly unveiled plan to allow states to, again, do this blockade program. This is what they've been kind of trying to do here. Saying, quote, I work in one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is this going to affect my patients? So here, let's see if we have a little bit of a video about this. We got 2 audio clips for you about this, so it's a lot of fun. You did happen to luckily film it for us, so hopefully we will be able to play that for you here and get the sense of what exactly is going on. All right, so you can hear the full clips here, because I think it is pretty important.
Hey, gentlemen.
Hey,
how you
doing?
Rob Davidson. How you doing?
Hey, Rob. Good to meet you.
Hi there. I'm Joel.
Joel. So I'm
Nice to meet you, Mr. Vice
an
President.
emergency doctor. I'm worried about plans they talked about last week of maybe cutting Medicare, and then the rollout today of cutting Medicaid. I work in one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is that going to affect my patients?
All right, watch for this answer. So like our patients care on Medicaid. It's very, very important for us. We really need it. And this is the response from Mike Pence, coming in strong with an authoritative defense of his policy.
Yeah. I hadn't heard about cutting some Medicaid.
Cut Medicaid, yeah. The head of CMS announced the plan to let states file for waivers so they could get block grants. So that would essentially cut the amount of money going to the states. So that would cut federal Medicaid funding. Is that a good idea?
Actually, when I was governor of Indiana, we got a waiver from the Obama administration that actually allowed us to expand Medicaid coverage in the states.
Right, but now they're talking about scaling back the Medicaid expansion that we got with the Affordable Care Act, and that 680,000 Michiganers, 600,000 in Iowa. I mean, a lot of people got health care.
We expanded coverage in Indiana.
Right, but I'm just talking about the president and your administration right now, what they're doing. Right now, they're cutting Medicaid.
Those are waivers for states that didn't take expansion.
No, it's for people who took expansion money too. I mean, your administration just announced this. They rolled it out today, and it's going to affect millions of people across the country cutting Medicaid. I mean, is that a good idea, or is that a bad idea?
I think you're oversimplifying it.
Well, I think it comes down to that for the people I take care of all the time. I mean, people I see in the emergency department that can't get primary care doctors, once they got Medicaid, they could get primary care doctors. They stay out of the ER. They actually work more. They actually contributed to our community more. Now, if a couple of people sorry you don't get your health care, I mean, that's going to be a real negative in their lives.
Yeah, I mean, so that really is a kind of a great way of putting it. Like, it's respectful, so it's not going to be like call it out on Twitter and be like, oh my gosh, like, what a disrespectful guy. He's like incivility on the left, whatever the case may be. Like, and like, who knows what this guy's political affiliation is? He very well could be like a Republican guy. So it's probably a wealthy like doctor, whatever. And like him is coming out and saying, oh, this is something that's going to really hurt my patients. Like, it's going to be, as he says, it's going to be really negative in their lives. Like, obviously, like it's not that hard to see how this could be an incredibly tough, incredibly devastating thing for a lot of people to deal with. And it's like, yeah, because it's just so disturbing to see that how easily this healthcare could be cut, and how many people really do rely on this. So again, this is the second little clip of this, and he really knows his stuff. Probably educating him on this policy, which he hasn't heard about apparently. So yeah, that's a big apparently there on that one, which is something that is not entirely the most reliable thing in the history of the world. All right, so here he is writing. When I told him he's putting my patients' lives at risk, VP deflected and denied knowledge of the policy. He either doesn't understand or doesn't care about the administration's policies on patients. The impact of this administration's policies on patients everywhere. Here's the second clip.
Well, if you check out what we did when I was governor of Indiana, the Healthy Indiana Plan, which was the first consumer-directed order that was given ever. We expanded coverage. We used consumer-directed health care.
But that's not
now.
now.
Take more ownership of our health care and expand it.
I mean, the Trump administration, you do want to expand Medicaid, that'd be great. But the problem is they're contracting Medicaid.
It's a matter of improving. I think Medicaid, is a lot of problems.
It's been a godsend to the patients I serve in one of the poorest counties in the state of Michigan. And I know people here who work in Des Moines, friends of mine who work in the ERC in Des Moines will tell you Medicaid is a godsend.
Well,
it's people with diabetes who can't afford insulin.
I think our vision is for state-based innovation and reform to be able to improve.
Reform and innovation in the setting of cuts equals less people with health care.
Yeah. I respectfully disagree.
Okay. Okay. Well, I encourage you to make sure that we don't cut those folks off of Medicaid because they need it. Okay.
Thanks for your courage and care.
All right. Thanks.
True. Thank you, man.
Thanks for talking.
Yeah. Nice to meet you, man.
Thank you, sir.
All right. So yeah, that's an interesting window into how Mike Pence's I'm in trouble behavioral setting takes into place. Because every politician has one when they're being confronted. They're just like, oh, like what am I going to do? What am I going to do? Yeah. So that is the probably the most blatant, most interesting confrontation yet of hopefully many to come on this. Definitely worth someone keeping an eye on. Because have really, really broad-reaching implications for people all across the country. All right, quickly here, I do want to move on to some very good news. In a historic step, the House has voted to repeal the 2002 AUMF that Trump used to justify Soleimani in the assassination there. The House of Representatives on Thursday voted to repeal the 2002 Iraq authorization for the use of military force, which Trump administration cited as a legal justification for the assassination of the Iranian general Qasem Soleimani in Baghdad earlier this month. The legislation, sponsored by a longtime war on terror opponent Barbara Lee, passed by a vote of 236 to 166, so a relatively close vote there, with 11 Republicans supporting the measure and 2 Democrats, Connor Lamb and Jim Cooper, of Pennsylvania and Texas, respectively, opposing it. For far too long, Congress has been missing in action on matters of war and peace, but today we took an historic step to reassert our constitutional authority and stop endless wars by voting to repeal the 2002 Iraq AUMF. And I think this is something that Congress should really get some credit for. It's probably not going to really have success in the Senate, and even if it does, it will be vetoed by President Donald Trump. But this is, again, the same guy who killed Soleimani and then who vetoed the War Powers Act with respect to Yemen. So if this is repealed, it's going to be such a big deal because it has been the justification for every bad thing that we have done in the Middle East since 2002. It's always this AUMF, this few words in this small document kind of just hammered out there that have allowed us to cause so much chaos and so much stability and engender so much hate against us in the region here. So it's very, very good to see this stop. Here is what Barbara Lee put out as this was happening.
much, Madam Speaker. First, let me thank the chair.